This video is specifically for patients who had received sinus lift procedure. In addition to the previous video that speaks about all of the medications, what to eat, what to do, how to sleep, such as, for example, sleeping in a cooler room with 2 pillows. Very important so that your head is not congested when you wake up in the morning. So get your head elevated during the sleeping time and sleep in a cooler room. Very specifically for patients who had received sinus lift procedures, I'm going to reiterate some things that are very, very important. The nasal passages here and the opening that we have to the sinus, from the nose to the sinus, is a very narrow canal. And that canal gets congested. And one way to clear the sinus from all of the stagnant blood that's in the sinus right after the procedure is to keep the canals open during the healing time. And to do that, you have to avoid doing many things and do other things. Few things to avoid is to blow your nose very forcefully. You should not be blowing your nose at all. When you sneeze, you should always sneeze with your mouth open, not with your mouth closed. Otherwise, the whole graft will come out. You want to absolutely avoid that. Now, for the nasal hygiene, you want to use saline hypertonic saline, not isotonic, hypertonic saline. You get this at CVS over the counter, and it's in the nasal decongestant department. You also need to have an Afrin, no drip, and you need to have a Flonase. So I'm going to show you how to use this, because the very first step, every day, 3 times a day, you want to be cleaning with this. Twice a day, you want to be taking Afrin, and Flonase is to be used after 7 days, not before. So, but have it available. So let's start with this first step. From the very next day, you're going to take this, and I'm going to do it for you so that you can see exactly how to do it. You're going to essentially use the spray in each nostril for 5 to 10 seconds each. So I'm going to do it for you now. Now it's dripping. You see that? You don't blow your nose. You just let it drip and take a tissue and dry it like that. You will notice there will be blood coming out of your nose, and that's the blood that's stagnant in the sinus. So if you see blood, it's actually good. So it's all right if you have blood. If you have clots, that's perfectly fine. Just use more saline if it keeps coming out throughout the day. Use more saline in this manner. Do not blow your nose just like we did right now. So let me show you. After we're done with this, you're going to take Afrin and you're going to squirt at least 1 squirt, if not 2, per nostril twice a day. So let's do this together. You're going to come here, do this, and take a squirt. Easy. If that doesn't do it, you could add another squirt or another puff so that it decongests you and makes you feel comfortable. It also reduces the swelling so that the nasal passages, the canals from the sinus to the nasal cavity, stays open so that all of the drainage keeps going for a few days after the procedure. So this is specifically for the sinus lift patients. Other items that you in addition to the video that we just did, is essentially the swelling in the face. You might have a moon face the day after the procedure. You will have swelling, bruising. It's totally normal. Patients have reported that they don't have a lot of pain. It's just that they have a very swollen face, and it's totally normal. So if that happens to you, just expect it to be, and it will go down naturally. If you have bruising here, that bruising, if it goes to the eyes, you will have a black eye. So just bear with it until it's done, until it's over with, and then you'll be just fine. Continue your hygiene, continue your antibiotic therapy, absolutely as prescribed, your pain medication, your oral hygiene, as well as your nasal hygiene. By doing all of these together and avoid exercise for at least 15 days after the procedure, that will get you the result that we want, which is stability of the surgical site right after the procedure. And that should be it. And I wish you well, and we'll see you next time.